Today's topic is on pregnancy, and we are going to look at an introduction and a general overview of pregnancy. And so, when we say pregnancy, it is the state of having products of conception implanted normally or abnormally in the uterus or elsewhere. What do I mean by this? Let's use this scheme to explain it. Now, the product of conception is from the union of the egg or the ovum and the male sperm, which leads to the formation of a fertilized ovum, which we call the zygote. Now, the zygote contains all the genetic materials which are needed for life. The zygote then begins its journey down the fallopian tube towards the uterus. And as it moves towards the fallopian tube, we have series of cell division which takes place. And so by day one, we are going to have two cell division. By day two, we have four cell divisions. Then we have 8 cells. Then we also have 16 cells, and so on. And so we get a cluster of cells which is formed called the morula by day 4. Now, as the morula approaches the uterus or the uterine cavity, a fluid-filled cavity forms within the morula to become the blastocyst by day 5. The blastocyst then burrows into the uterine cavity, as you can find over here, and that is what we call implantation. And so it is the blastocyst which implants between day 6 and day 9. So this is a simple overview of how the zygote transitions. Now, from the blastocyst, we get the trophoblast and the inner cell mass over here. The trophoblast then forms the placenta and the chorion, whilst the inner cell mass gives rise to the embryonic tissue, that is, we get the ectoderm, the mesoderm, and the endoderm. And so, in other words, we get the fetus, the amnion, and the umbilical cord from the inner cell mass. Now, as the trophoblast erodes the endometrium or the deciduum, and the blastocyst implants, we have smaller blood vessels which are broken down and new ones are formed just to nourish it. This leads to light bleeding or spotting, which is found by these women, and this is what we call implantational bleeding. And this bleeding usually occurs around the time of the expected menstruation of the woman, and so it's usually mistaken for menses. Now, there are two parts of the trophoblast. We have the innermost layer, which is the cytotrophoblast, and we have the outermost layer, which is the syncytial trophoblast. Now, it is the cytotrophoblast which fuses to form the syncytial trophoblast. And the function of this syncytial trophoblast is that it is the main site of exchange for drugs, nutrients, waste materials, and other immunological substances between maternal and fetal circulation. This syncytial trophoblast also secretes some estrogen, progesterone, and human chorionic gonadotropin hormone, as well as the placental lactogen by week 8 of gestation, whilst the cytotrophoblast also secretes the human chorionic gonadotropin hormone. Now, the main function of the HCG is to maintain the corpus luteum until the placenta is developed enough to take over the production of progesterone. And so these are the series of events which takes place whilst implantation occurs. And so as you can see, we also have the yolk sac which is formed over here. Now, normally we have implantation occurring at the upper uterine segment, preferably in the fundus of the uterus, and it is followed by anterior as well as posterior implantation. However, we also have lower uterine segment implantation, which occurs, and this is when we talk about the various forms of placenta previa. And so, in this image, you can see that this is the placenta, and this is the cervix. And so, we have the placenta lying in the lower uterine segment, and this is marginally. Yes. Now, we also have the partial implantation, whereby uh, the placenta partially occludes the internal cervical os, as you can find over here. Then we have total implantation or total occlusion of the internal cervical os by the placenta, and so this is what we call the total implantation. These form the various types of placenta previa that we have. Then also we have implantation occurring outside of the uterus, which can be in the fallopian tubes, in the ovaries, as well as even in the abdomen, as you can find in this image. Here being the cervix, we have in the ampulla as well as in the isthmus, sometimes in the ovaries and also in the abdomen. So these are various forms of ectopic pregnancies that we have. Now, there is a separate video on placenta previa in ectopic gestation, and so you can watch it for better explanation on the topic. But as we continue, we have what we call molar pregnancy. And this is the abnormal proliferation of the trophoblast or the placenta tissue that we talked about. Now, we shall discuss that in a separate video. However, what I want you to know is that this is not compatible with life. Finally, the pregnancy is terminated by spontaneous or elective abortion or by a spontaneous vaginal delivery. And so the woman may miscarry the pregnancy from known and unknown causes or on medical advice. And she may also deliver by herself, that is, the spontaneous vaginal delivery, or through a cesarean section. Now let's move on to some terminologies that we need to know when we talk about pregnancy. The first being an embryo, which is the time of fertilization until the pregnancy is 8 weeks old. Now, the fetus is after 8 weeks until the time of birth. Then we have the infant and the neonate. Now, between the time of birth and 1 year is called an infant. Now, the neonate is an infant from birth until the first 28 days of life. And so we may have an early neonatal period and a late neonatal period. Now, these designations does not only help us to monitor the infant's development, but they also help us to identify certain organisms which may infect the infant. For example, agents causing early neonatal sepsis may include the group B strep as well as the E. coli and even the staph aureus, whilst late neonatal sepsis may be caused by E. coli as well as the coagulase negative and even candida. And so these designations are very important when we talk about the neonate. Then we have what we call the pre-viable period, which is the period before 24 weeks and 28 weeks of gestation. Now, let me explain this well. The 24 weeks is considered to be pre-viable in developed world and before 28 weeks in developing countries. And so any delivery between 24 and 37 weeks is considered preterm in the developed world, and between 28 and 37 weeks is considered preterm in the developing countries. Now, the differences in the period of viability is partly due to the availability of facilities to sustain life in the developed world or in the developed countries. And so, in developing countries, these facilities are not available, and so we are not able to, take care of the baby when it is born before the 28 weeks of gestation. And there are a lot of evidence to show that in the developed world, babies who are born before 28 weeks are able to survive because of the resources they have, which is not readily available in most developing countries. And so when we say preterm, it is between 24 and 37 weeks of gestation, as I've already said, in the developed countries, and 28 and 37 weeks of gestation in developing countries. And when we say term, it is between 37 and 42 weeks of gestation. Now, the word term, is a range which spans 1 month or 4 weeks, starting from 37 completed weeks to 42 weeks. We call it term because during this period, the fetus is matured enough to live an independent life outside the uterus. And so we can have an early term, we can have a full term, and also a late term. When we say an early term, it is between 37 and 0 days and 38 with 6 days. And when we say full term, we have 39 complete weeks with 0 days and 40 completed weeks with 6 days. And the late term will be between 41 completed weeks with 0 days and 41 completed weeks with 6 days. And so mathematically, when we say term, it is the expected date of confinement plus or minus 2 weeks. Now, the next term we need to know is the post term, which is the period beyond 42 weeks of gestation. Now, post date is different from post term, and post date is when the woman has exceeded or has gone beyond her expected date of delivery or expected date of confinement, that is more than 40 weeks of gestation. We also need to know what we call stillbirth or intrauterine death. Now, there are differences in the definition of what stillbirth is, but according to the WHO, stillbirth is a baby who dies after 28 weeks of gestation before or during birth. And so it can be early, which occurs between 20 and 27 weeks. It can also be late, which occurs between 28 and 36 weeks. Or we can have a term stillbirth, which occurs between the 37 weeks or more. Then also we have other definitions such as the fresh stillbirth and the macerated stillbirth. What do they mean? A fresh stillbirth is the death of a fetus during labor or delivery, whilst macerated stillbirth is the intrauterine death of the fetus before the onset of labor, where the fetus now shows degenerative changes, and so you may find the skin peeling off, and also some other parts of the baby becoming necrotic, and even sometimes gangrene setting in. Then also we have what we call gravidity, and gravidity refers to the number of times a woman has become pregnant, and this is regardless of the outcome of pregnancy. And we also have what we call the parity, and this also refers to the number of pregnancies that has gone beyond the period of viability, or if the baby born weighs more than 500 grams. And so over here, if the woman gave birth, or if the woman, delivered before the 28 weeks of gestation, we cannot count it as part of the parity of the woman. However, it forms part of the gravidity of the woman. Then we also have designations such as nolly, premi, and multi. Now, these are prefixes which we use when we are talking about gravidity and parity. And so when we say nolly gravid, we mean the woman has no history of pregnancy. When we say primigravid, it means the woman has a history of one pregnancy. And when we say multigravid, it means the woman has a history of two or more pregnancies. The same thing applies to the parity. And so when we say nolly parity, it is a woman who has no history of completed pregnancy that has gone beyond the period of viability. That is the 28 weeks of gestation or 24 weeks of gestation. It can also be a woman who gave birth and the the weight of the child was not more than 500 grams. So this will be a nolly parity. And a parity or a primiparous woman is the woman who has a history of one completed pregnancy that went beyond the period of viability. That is more than 24 weeks of gestation or 28 weeks of gestation, and the birth weight was more than 500 grams. Then when we say multi-parity, we mean the woman has history of more than one pregnancy that went beyond the period of viability and also ended with the birth weight of more than 500 grams. Now, we have what we call the grand multiple or grand multiparity, and this refers to a woman whose parity is greater than or equal to 5. For example, a woman who has been pregnant twice is gravid at 2. One ectopic pregnancy and one full-term birth will be multigravid and a primiparous woman. Now, other terms we need to know is what we call the postpartum period. And this is the period of 6 to 8 weeks during which the reproductive organs return to their pre-pregnant state, and this is what we refer to as involution. Now, the GT-PAL system and the GPA system is the next term that we can or we also need to understand. Now, we shall look at these terminologies, but before that, we need to know that pregnancy is also divided into terms or into trimesters. And so we have the first trimester, which lasts until the 12 weeks of gestation. Then we have the second trimester, which lasts between the 12th and 14 weeks until the 24th or 28th week of gestation. Then we also have the third trimester, which is between the 24th or 28th week of gestation until the woman delivers. Now, the GT-PAL system and the GPA systems are designations which we use in describing the outcomes of pregnancies. And so when we look at the GT-PAL, the G represents gravidity. That is the number of pregnancies the woman has had, including the current pregnancy, as well as the abortions, ectopic gestations, and other forms of pregnancies, including hydatidiform moles. Now, it is important for us to note that multiple gestation count as one pregnancy, even though the woman may have two or more babies born from it. It's still counted as one pregnancy. Now, the T in G2 power system is the number of term infants which were delivered. That is at 37 complete weeks or more. Then we also have the P representing the number of preterm infants, that is before the 37 completed weeks of gestation. And the A represents the number of abortions, which is any bleeding before 20 or 28 weeks of gestation, as well as delivery with a birth weight less than 500 grams, are all considered as abortion. And these may be either induced abortions or spontaneous abortions or even medically advised abortions. We count all of them as part of abortions when we are recording or we are taking the history of pregnancy outcomes in the woman. Now, the L represents live, that's the number of live infants which have been born to this woman. And so let's look at some examples to make everything very clear. If we have a woman who has a set of preterm twins, one term infant, and two miscarriages, the GT PAL is going to be gravida 4, term 1, preterm 1, abortions 2, and live bones 3. How did we arrive at this? It's very simple. We said the woman has had one set of preterm twins. So that was her gravida 1. Then one term infant making gravida 2, and two miscarriages making gravida what? 4, because she's had two separate pregnancies which she miscarried. Now, she had one term infant giving her term 1, and she's had one term, one preterm twins, making her P1. And because she's had two miscarriages, she's had what? 2 abortions. Now, when we count the number of babies born alive, we are going to have 3 because the preterm twins gave us 2 babies and the one term infant gave us 1, making 3 live borns. Now, when we look at the GPA system, the GPA system also talks about gravidity, para, and abortion. And so the gene still represents gravida as we've seen before. And so the number of pregnancies that the woman has had, including the current one, as well as abortions, ectopic pregnancies, and hydatidiform moles. And still, multiple pregnancy represents one pregnancy and not 2. The P in GPA system is para and not preterm. And so you must take note over here. It is para and not preterm. And it talks about the number of pregnancies which has gone beyond the 28 weeks of gestation or has gone beyond the period of viability, as we explained earlier on. And also led to the birth of, a baby who weighed more than 500 grams. And so if the woman delivered before the 28th week of pregnancy, in developing worlds, we will consider it as an abortion, as well as if the birth weight is less than 500 grams. We will consider it as an abortion. However, in the developed countries, birth before 28 weeks of gestation will be considered as preterm or even pre-viable. And if the birth is before or the birth weight is less than 500 grams, then we will still consider it as a para for that woman. But in developing countries, any delivery which occurs before the 28th week of pregnancy, we do not count it as part of the births that the woman has given. And so we consider it as abortion. And so para is the number of pregnancies beyond 28 weeks. If it's not beyond 28 weeks, you don't count it as part of the para or the number of babies the woman has delivered. Now, the A still represents abortions as we've seen before, including medically advised abortions. And so let's look at more examples to make this very clear. We have Amma, who previously delivered one live singleton at 39 weeks. She's on her fourth pregnancy and also had one live singleton at 35 weeks 7 days and one live set of twins at 34 weeks 7 days. You can pause it and try it yourself if you can get the answer. But in this example, the GT PAL is going to be grabbed at 4, term 1, preterm 2, 0 abortions, and 4 live borns. How did we arrive at this? We said it's her fourth pregnancy, so grabbed at 4. And she gave birth to one live, singleton at 39 weeks, so term 1. And she's also had one live singleton at 35 weeks, which is giving her preterm 1, as well as one live set of twins at 34 weeks, and so preterm 2. That's why she's having 2 preterms. She's never had any abortions, and the number of the babies who were born live will be 4 because she's having one live term at 39 weeks, one live singleton at 35 weeks, and one set of twins, which are 2 babies. And so she's going to have 4 live deliveries. Now, the GPA is going to be gravida 4, para 3, and 0 abortions. Gravida 4 because it's a fourth pregnancy, para 3 because all the deliveries went beyond the period of viability, which is 28 weeks that we've already explained. Now, let's look at more examples. We have Miss Fatima, who has 5 pregnancies, 2 miscarriages at 11 and 14 weeks, respectively, 1 medical abortion, 1 delivery at 40 weeks, and she's had 1 delivery at 30 weeks but died soon after birth. So, what's going to be her GT PAL and GPA system or scoring? So, with a GT PAL, she's going to be gravida 5 because we said she's had 5 pregnancies. She's going to have 1 term because we said she delivered at 40 weeks, which is 1 term. Then she's going to have 1 preterm because we said she also had 1 delivery at 30 weeks. Then she's going to have 3 abortions because she miscarried her pregnancies at 11 weeks and 14 weeks and also had 1 medical abortion. And so she's having 3 abortions. Now, the number of deliveries or the number of babies born live is going to be only 1, which is the one she had at 40 weeks because we said the one which she had at 30 weeks died soon afterwards. So she has only 1 live baby born. Now, the GPA system is going to be gravida 5 and she's going to have para 2. Para 2 because we said she had 1 delivery at 40 weeks as well as another delivery at 30 weeks, which went beyond the period of viability. That's why she's having para 2. And she's going to have 3 abortions, as we've seen, 1 at 11 weeks, the other at 14 weeks, and also 1 medical abortion. Let's look at more examples. We had Miss Akosia, who has given birth to a live girl at 32 weeks gestation, and it's her first known pregnancy. So her GT PAL is going to be gravida 1, term 0, preterm 1, and 0 abortions and 1 live. And I think this is straightforward because it's her first known pregnancy. So G1, the delivery was at 32 weeks, and so she didn't get to term. So T0, and since it's 32 weeks, it's preterm. P1, no abortions, and that's the only live delivery she's had. So L1. The GPA is going to be gravida 1, para 1, and 0 abortions. Para 1 because it went beyond the period of viability. Now, let's look at another example. We have Miss Afia, who is 30 weeks pregnant. It's her fourth known pregnancy. Her first pregnancy was miscarried at 12 weeks. The second led to a live, twin at 37 weeks, and the third also led to a spontaneous vaginal delivery at 34 weeks gestation. And so her GT PAL is going to be Gravida 4 because we said it's her fourth known pregnancy, and she's had one miscarriage at 12 weeks, which is going to be the only abortion she's had. Then also the second led to live twin at 37 weeks, so which was term, so T1, and the third led to spontaneous vaginal delivery at 34 weeks, which was preterm, and so P1. Now, when we count the number of babies alive, we are going to have the live born at 37 weeks, which is 1, and the twins, which are 2 babies, and so she's going to have 3 babies alive. The GPA is going to be Gravida 4, Para 2, and 1 abortion. Para 2 because both deliveries went beyond the period of viability. Then we have 1 abortion. I think we have one last example, which is Miss Akosia, who is 18 weeks pregnant, and it's her third pregnancy. Her first ended in spontaneous vaginal delivery at 40 weeks gestation, and the second resulted in cesarean section at 38 weeks. And so her GT PAL is going to be Gravida 3, term 2, preterm 0, abortion 0, and 2 live babies. Gravida 3 because we said it's her third pregnancy, and we have 2 terms because her first ended at 40 weeks and the second also ended at 38 weeks, so she had 2 term deliveries, and she's not had any preterm, so P0. She's not had any abortion, so A0, and the 2 babies are alive, and so we have we have L2. Then the GPA is going to be Gravida 3, Para 2, and A2. Para 2 because both pregnancies went beyond the period of viability, and she's not had any abortion. And so these are the introduction to pregnancy as we've seen. In our subsequent video, we are going to look at how to date pregnancy and how to diagnose pregnancy. Thank you very much for your attention. Bye-bye.